I'm Adams County Sheriff Mike McIntosh. Opioids are an epidemic in our society today, and Adams County is no exception. In fact, in a 5-year span, from 2011 to 2016, nearly 300 Adams County residents have lost their lives to this epidemic. In response, effective policies and practices are needed, which include the following 6 pillars: prevention, treatment, recovery, overdose reversal, law enforcement, and criminal justice reform. The reality is, if we're going to do better for individuals, families, and our communities, the foundation for response needs to be built on all of these key pillars collectively. Otherwise, we're not building a solid foundation that's necessary for our response to work. Our ultimate goal is to link individuals to the services and treatment options they need. This will not only help prevent initial and future contact with the criminal justice system, but it will also support stabilization, along with treatment and recovery in a more supportive and appropriate environment. The Adams County Criminal Justice Coordinating Council and its member agencies have been impacted by the opioid epidemic, and therefore have responded using these key pillars in a variety of ways that we would like to share with you in this video. We hope to offer a sample of promising programs linked to these key pillars occurring in Adams County.
The CJCC and its member agencies are building on proven methods developed at the community level to enable long-term recovery by connecting prevention and education efforts with treatment programs. In Adams County, there is no better example of a comprehensive, system-wide approach to addressing the opioid epidemic than the Tri-County Overdose Prevention Partnership. This was formed in 2016. This public and private partnership, facilitated by Tri-County Health, is a community-based effort that was initially called into place by commissioners of both Adams and Arapahoe counties. The main goals were to 1. Prevent opioid deaths, and 2. Increase awareness and education of the factors leading to an overdose. Their strategic framework includes the following: youth prevention, public awareness, provider education, safe disposal, naloxone, and treatment. Prevention also includes efforts from those with boots on the ground. In April 2016, the Thornton Police Department and the Community Reach Center came together to talk about the gaps in services for people in our community who are seeking behavioral health services. Through this partnership, these agencies realized that if they could find a way to share information between them, they could identify possible solutions to improve service delivery by both law enforcement officers and Community Reach Center staff. In response, these agencies launched a pilot project to exchange information. In 2017, the Adams County Criminal Justice Coordinating Council was awarded $50,000 from the MacArthur Foundation to support this pilot project. Overall, this project aims to do the following: 1. Reduce the unnecessary use of first responders. 2. Reduce the amount of 911 service calls for behavioral health crisis needs. And 3. Reduce the likelihood of unintentional criminalization. Our hope for this project is to learn how we can make system changes to better support stabilization, treatment, and recovery in the community. One of the sustaining goals of this project is to build an infrastructure that can be replicated by any law enforcement agency in Adams County. For nearly 60 years, the Community Reach Center has been an integral component of excellence in behavioral health care for Adams County. This center provides a broad and diverse array of services and treatment to meet every need and circumstance. From patient sessions with a therapist and a variety of wellness and therapy groups to community-based services provided in schools, along with crisis mobile services, social detox, and substance use services, as well as crisis services. The Community Reach Center also provides justice and jail services. Justice Services supports individuals, both adults and youth, in an outpatient setting, while Jail Services also supports adult inmates at the Adams County Detention Facility. In 2016, the Adams County Board of County Commissioners allocated over $3.2 million to renovate and build a new mental health unit within the Adams County Detention Facility. Behavioral health services will be provided by the Community Reach Center, and the separate living spaces and treatment areas can service up to 32 inmates. Naloxone is an FDA-approved medication used to prevent and reverse overdose by opioids such as heroin and morphine. The Adams County Sheriff's Office, including the detention facility and patrol, have been trained to administer naloxone. Since the fall of 2016, Thornton police report that naloxone has been administered 21 times. People suffering from substance use disorders often get caught in the cycle of arrest and incarceration. In Adams County, we must relentlessly pursue public policy solutions for the underlying problems. These include restorative criminal justice reform, drug treatment and behavioral health care, along with alternative courts like the Veterans or CESE courts, which stands for Community Engagement, Supervision, and Evaluation. This is a post-sentencing probation model for mental health and substance use. And finally, there's drug court. Drug court, for example, provides individuals with intensive case management and can connect them to care resources out in the community. In Adams County, our range of specialty courts have formed partnerships which include the following: judiciary, including that of probation, along with public safety agencies, and other community partners. These courts are considered effective because they leverage targeted, coordinated care resources to do the following: 1. Reduce substance abuse. 2. Reduce crime. 3. Reduce the repetitive use of criminal justice resources. And 4. Restore lives. For the first time in both Adams County and across the country, we are properly tackling substance addiction as both a public health and public safety issue, with both communities working together to tackle the problem. The conversation to combat this epidemic must continue among all of us to ensure the health and well-being of all residents. And this comprehensive response must include the promising practice efforts highlighted in this video.